If you feel like your depression still has too much control over your life and you haven't benefited from drug therapy, you are not alone. Now may be the time for you to consider a new direction. NeuroStar TMS therapy is bringing new hope every day to people who have not benefited from antidepressant drug treatment. NeuroStar TMS therapy is a non-invasive medical treatment that you have right in your doctor's office. It's available by prescription only and delivered under the supervision of a psychiatrist. NeuroStar TMS therapy is targeted, stimulating only the area of the brain thought to be involved in regulating mood. NeuroStar TMS therapy is safe and easy on the body. No medication is required. This non-drug treatment has none of the systemic side effects commonly associated with antidepressant medications. The most common side effect associated with NeuroStar TMS therapy treatment is scalp pain or discomfort, generally mild to moderate. Also, there is a rare risk of seizure associated with TMS therapy. TMS therapy should not be used in patients with non-removable metallic implants in or around the head. NeuroStar TMS therapy is safe and effective for the treatment of adult patients with major depressive disorder who have failed to achieve satisfactory improvement from one prior antidepressant medication of adequate dose and duration in the current episode. In clinical trials, patients treated with active NeuroStar TMS therapy experienced an average reduction in their depression symptom score of 22.1%. compared to a 9% reduction in patients receiving inactive treatment. In open-label clinical trials, 1 in 2 patients suffering with depression improved significantly, and 1 in 3 patients were completely free of depression symptoms after 6 weeks of treatment.
6 weeks out, I was done with the NeuroStar TMS therapy, and the depression had gotten tons better. I really did not feel depressed anymore. And it is now, I would say, about 2 months out, and I can function normally. I can get up in the morning and have motivation and experience joy around people and clean my house and, function like a normal person functions.
TMS therapy is not right for everyone. So talk to your doctor to learn more about how this exciting, proven treatment has helped other people with their depression and whether it may help you. This video will provide an overview of NeuroStar TMS therapy. Other chapters will include information on how it works, what to expect with TMS treatment, patient experiences with NeuroStar TMS therapy, and important information about its safe use. How is depression treated? Psychiatrists treat depression in a variety of ways, usually starting with psychotherapy and first-line antidepressant medications. If these therapies do not work, psychiatrists often resort to other antidepressants. In 2010, the American Psychiatric Association released revised practice guidelines for the treatment of depression. Beyond psychotherapy, typical first-line depression treatments include antidepressant medications known as SSRIs, DNRIs, or SNRIs. These medications are thought to work by regulating the amount of neurotransmitters, or chemical messengers, in the brain. Because antidepressant drugs circulate throughout the body in the bloodstream, they may result in unwanted side effects. For some people, first-line antidepressant drugs are not effective and other options need to be considered. Patients can switch to a different type of antidepressant medication, such as an MAOI or TCA, or try an augmenting strategy where another medication is added to their current medication. If depression symptoms still persist, an atypical antipsychotic medication may be added. These additional treatments can also result in a number of side effects. For patients who have not benefited from first-line antidepressant treatments, an alternative approach is available. NeuroStar TMS therapy offers a proven, non-drug treatment for depression. The most common side effect associated with NeuroStar TMS therapy is scalp pain or discomfort. NeuroStar TMS therapy is indicated for the treatment of major depressive disorder in adult patients who have not benefited from one prior antidepressant medication at or above the minimum effective dose and duration in the current episode. Now let's hear how NeuroStar TMS therapy works. How does NeuroStar TMS therapy work? Depression is often treated with antidepressant medications, which are thought to impact mood by modifying neurotransmitter levels. Neurotransmitters are the brain's chemical messengers. Medications are effective for many, but can cause problems for others. Antidepressant medications circulate in the bloodstream throughout the body and may result in unwanted side effects. For patients looking for a non-drug treatment option, NeuroStar TMS therapy is a non-invasive outpatient therapy performed in your psychiatrist's office. It has none of the systemic side effects commonly associated with antidepressant medications. The most common side effect reported is scalp pain or discomfort. During the therapy session, your clinician uses a treatment coil about the size of a cupped hand to send a pulsed magnetic field similar in type and strength to magnetic fields produced by magnetic resonance imaging or MRI machines to the part of your brain thought to control mood. TMS therapy is a targeted treatment reaching 2 to 3 centimeters into the brain directly beneath the treatment coil. Unlike antidepressant medications, which circulate throughout the body, this method allows for precise, focused stimulation, minimizing the impact on brain tissue not involved in mood regulation. The pulsed magnetic field produces very small electrical currents within the brain, so small they cannot be felt by the patient. It is believed these currents cause brain cells, known as neurons, to become active. This activity leads to the release of neurotransmitters. Over the course of treatment, this increased brain activity has been observed in patients who experienced relief from their depression symptoms. What to expect with NeuroStar TMS therapy. NeuroStar TMS therapy is indicated for the treatment of major depressive disorder in adult patients who have failed to achieve satisfactory improvement from one prior antidepressant medication of adequate dose and duration in the current episode. It's available to patients by prescription only and is delivered under the supervision of a psychiatrist. A typical course of treatment includes 20 to 30 treatments spanning 4 to 6 weeks. Each TMS therapy session is a short outpatient treatment that lasts about 37 minutes. During therapy, you're wide awake in a comfortable chair. No anesthesia or sedation is required. You can speak with the system operator whenever necessary. At your first treatment session, your psychiatrist will start by using the treatment coil to perform a test to identify your motor threshold. The motor threshold is the amount of magnetic field strength that results in a visible movement of your right thumb. This test is important because it identifies the magnetic field strength that will be used in your treatment session. This field strength is customized for each patient to deliver the correct treatment dose. The motor threshold test will also identify the position on your head in which to place the treatment coil to allow you to receive optimal treatment. When the physician begins your TMS therapy session, the device will deliver rapid pulses of the magnetic field in 30-second intervals. This will feel like tapping on your scalp. Many patients are comfortable during treatment, while some may find this tapping unpleasant. If you experience discomfort during treatment, tell your physician. Your physician may be able to make adjustments to the treatment coil to reduce this discomfort.
To me personally, it was pain-free. There is a little small amount of tapping on your head when the treatment's going on, not continually. It stops and goes. I did not experience any amount of pain whatsoever. The chair was very comfortable. It was a 37-minute treatment that went very easily for me.
The most common side effects reported are headache and scalp pain or discomfort. These side effects typically lessen as further treatment sessions are administered. If necessary, you can treat any discomfort with an over-the-counter analgesic. If your discomfort persists, tell your physician. Upon completion of each therapy session, you can immediately return to work or other daily activities, including driving. Now, let's hear more from patients as they describe their depression and treatment with NeuroStar. Patient experiences with NeuroStar TMS therapy. In a controlled clinical trial comparing active treatment with the NeuroStar TMS therapy system to an inactive device, patients treated with active NeuroStar TMS therapy experienced a 22.1% average reduction of their depression symptoms, compared to a 9% average reduction of depression symptoms in patients receiving inactive treatment. In an open-label study, which is more representative of real-world clinical use, 1 in 2 patients suffering from depression improved significantly, and 1 in 3 patients were completely free of depression symptoms after 6 weeks of treatment. Let's hear from some actual NeuroStar patients.
I first became depressed as a senior in college. That was 19 years ago. I went from being fully functional and happy to being unable to do anything basic, like even read. I had to drop out of school. And for the last 19 years, I've been battling depression. I do okay for a while in some therapies, and then it will break through again. And just this past year, I had another very bad episode.
I had suicidal thoughts, very low, crying, no motivation, lack of interest in friends, family.
For me, depression was like a black hole of emotional just sorrow. It's just took away my entire life. I couldn't think, I couldn't work, I couldn't enjoy anything. I couldn't enjoy my children. It was just completely overwhelming.
I tried 4 antidepressants, which the doctors prescribed. They did not relieve any of my issues that I was having, and with them came many side effects that I wasn't willing to tolerate to get better.
I've been on dozens of drugs over the past 19 years, and I've had all kinds of side effects from them. Dry mouth to the point that my lips stick to my teeth, sweating, not being able to sleep, sometimes sleeping too much, just feeling drugged and tired. Some of them would work for a while, and then the depression would break through. Others didn't work at all.
I came to the point in my life that I had been depressed for quite a long time and decided the medications were not working and I needed to try a different path. And so I decided to try TMS.
The treatment is very simple, really. I mean, you just sit in the chair and it's very comfortable, you're relaxed, and the doctor is present and he monitors you, and you feel a tapping on your head. And you're 37 minutes later, you get up and you go home.
I would say about my 5th week of NorthStar TMS therapy, I started to see a difference and expressed that. Just felt more motivated in my home, probably a little more joyful around people, just a little bit more that normal feeling. And that seemed to improve through the 6th week, and now I'm 2 months out and looking forward to the future.
7 months ago, I was so depressed that I wasn't able to function. I couldn't work, I couldn't drive, I could barely watch television. After the 6 weeks of NeuroStar TMS therapy, I was back to work. I was feeling great. I was enjoying my kids again, and I had my life back.
The cost of depression, I can't even compare to the cost of what it is for TMS therapy. In my mind, I reached a point where I needed to get better. And I looked at TMS therapy. I studied it online. I talked to different doctors that do it. and I felt this was definitely the next step that I had to take.
People ask me if it's worth the money for TMS, and I say absolutely. For the price of admission, I've got my life back.
An effective option for treating major depressive disorder. Based on clinical trials and real-world experience, NeuroStar TMS therapy is an effective treatment of major depressive disorder in adult patients who have failed to achieve satisfactory improvement from one prior antidepressant medication at or above the minimal dose and duration in the current episode. In a controlled clinical trial comparing active treatment with the NeuroStar TMS therapy system to an inactive device, patients treated with active NeuroStar TMS therapy experienced a 22.1% average reduction of their depression symptoms, compared to a 9% average reduction of depression symptoms in patients receiving inactive treatment. Patients treated with NeuroStar also experienced significant improvement in anxiety and physical symptoms, such as appetite changes, aches and pains, and lack of energy associated with depression. In an open-label study, which is more representative of real-world clinical use, 1 in 2 patients suffering from depression improved significantly, and 1 in 3 patients were completely free of depression symptoms after 6 weeks of treatment. An independent, open-label study conducted under the sponsorship of the National Institute of Mental Health confirmed these results. NeuroStar's effectiveness has not been established in patients who have failed to receive benefit from 2 or more prior antidepressant medications at minimal dose and duration. It has also not been studied in patients without prior antidepressant medication treatment. In clinical trials, indicated patients had been treated with a median of 4 antidepressant medication attempts, 1 of which was at an adequate dose and duration. Safety of NeuroStar TMS therapy. Clinical trials have proven the safety of NeuroStar TMS therapy in treating depressed patients who have had an inadequate response to prior antidepressant medication. Treatment with NeuroStar TMS therapy caused few side effects and was generally well tolerated by patients. The most common side effects reported during clinical trials were headache and scalp pain or discomfort, generally mild to moderate and occurring less frequently after the first week of treatment. During clinical trials, fewer than 5% of patients discontinued treatment with NeuroStar TMS therapy due to adverse events. Over 10,000 active treatments were performed across all NeuroStar clinical trials, demonstrating its safety. During trials, no seizures or systemic side effects were seen. Also, no adverse effects on concentration or memory were reported. There is a low risk of seizure with TMS therapy. The estimated risk of seizure under ordinary clinical use is approximately 1 in 30,000 treatments, or 1 in 1,000 patients. NeuroStar TMS therapy should not be used in patients with implanted metallic devices or non-removable metallic objects in or around the head. NeuroStar TMS therapy should be used with caution in patients with implants controlled by physiological signals. This includes pacemakers and implantable cardioverter defibrillators, known as ICDs. NeuroStar TMS therapy is indicated for the treatment of major depressive disorder in patients who have failed to achieve satisfactory improvement from 1 prior antidepressant treatment at adequate dose and duration in the current episode. NeuroStar is available by prescription only and delivered under the supervision of a psychiatrist. Talk to your doctor to find out if NeuroStar TMS therapy is right for you. To view full safety and prescribing information, please visit neurostar.com or follow us on Twitter at TMS Therapy. To learn about other patient experiences with NeuroStar TMS therapy, visit www.thedepressionhopecenter.com.